Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
If you have been watching the news lately, you have surely heard about the new coronavirus, a new strain of virus that is sweeping across China and spreading to all other parts of the world. While historically coronavirus cause little need for alarm, they are usually the culprits behind the common cold. There are three strains that have been developed in the last 20 years, including this most recent strain, the 2019 NCOV, which are causing serious illness, respiratory issue, respiratory failure, and even death. Another example of a serious coronavirus is SARS, but it's important to note that the 2019 NCOV is not as same as SARS. Today's video is going to tell you about how to save yourself from coronavirus. So hello guys and welcome to Nuturemite, where we provide informative videos regarding health and lifestyle. So let's get started. So the obvious question that comes to our mind is, what is coronavirus? According to the Centers for Disease Control and Prevention, coronavirus are a large family of viruses that are common in many different species of animal. The CDC says that rarely does the animal coronavirus infect people. However, this most current strain is the new respiratory virus that was first identified in Wuhan, Hubei province, China, which has been infecting people. The World Health Organization says that common signs of infection include respiratory systems like fever, cough, shortness of breath, and breathing difficulties. Rarer, more severe cases can cause pneumonia, severe acute respiratory syndrome, kidney failure, and in most extreme, death. Symptoms may appear in as few as 2 days or as long as 14 after exposure. Like previous coronavirus, this particular virus likely emerged from an animal source, though experts are not sure which one as of yet. Now, the virus is being spread from person to person. Typically, coronavirus infections are transmissible person to person only once someone infected is showing symptoms. However, the Chinese health minister is indicating that this particular strain may be infectious when people are not yet sick. And now it's time to tell you that how to protect yourself. While there is no vaccine to prevent the 2019 NCOV infection, there are still things you can do to protect yourself. The best protection is hand washing and being mindful of contact with the person's face, said Dr. Eric Klopena, Director of Global Health for Northwell Health. The most common way viruses like these are spread is from droplets or little particles of viruses that land on a surface that another person touches and then spreads, usually by touching their face or eating, he said. The CDC recommends washing your hands often for at least 20 seconds with soap and water. An alcohol-based sanitizer can work in the absence of soap and water. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your mouth when you cough or sneeze with a tissue and throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. It's important to note that alcohol-based sanitizer like Purell are helpful, but not legitimate prevention measure to stop viruses. The CDC says that alcohol-based sanitizers can quickly reduce the number of microbes on hands in some situations, but sanitizers do not eliminate all types of germs. Using a hand sanitizer with at least 60% alcohol can help in the absence of soap and water, but it's not a treatment or prevention for virus. Now, You may think that what if you are traveling? So don't worry, we got the answer for you. At the time, traveling to China is probably ill advised. It is not clear how transmittable the virus is and who is at the greatest risk of poor outcome. The US State Department has issued a level 4 travel advisory for Hubei, which means do not travel, and is the highest warning level. A level 3 warning is in effect for the rest of China. The biggest risk to traveling to China right now is the strict quarantine and travel bans the Chinese government has been enacting, said Kioi Pena. That said, if you must travel to China where there are cases of virus, Amato recommends wearing a mask, washing hands often, and avoiding anyone that is ill. Note that over-the-counter masks don't protect against airborne illness. So if the virus mutates to become airborne, masks will be ineffective. The CDC is closely monitoring that status in the US. As of January 29, 2020, there are a total of 165 cases that have been under investigation. 5 were confirmed. States with confirmed cases are Arizona, Washington, California, and Illinois. According to Dr. Nancy Missonier, Director of the National Center for Immunization and Respiratory Diseases, we understand that many people in the US are worried about how 2019 NCOV will affect Americans. Risk depends on exposure. Right now, we have a handful of patients with this new virus here in the US. However, at this time, the virus is not spreading in the community. For the reason, we continue to believe that the immediate risk is low to American public. So thank you guys. If you found this video useful, please like, share and subscribe our channel Nuturemite, and don't forget to hit the bell icon.